Good morning. I'm Michelle Schmergy. I am a nurse, and I have spent the last 2 years working with a large team of clinicians innovating how to deliver healthcare. And we are trying to bring healthcare directly to patients, because you should really never let a good pandemic go to waste. So I want to talk to you a little bit about a patient, because a good nurse never doesn't start with a patient. So this is Mr. Jones. Mr. Jones is a patient of mine, and he is a wonderful older gentleman. He's 89 years old, and he has outlived his wife and his 2 children. He has been an amazing member of our society. He has served in a world war. He has given us unbelievable amounts of businesses that he started, and he is just a wonderful human. But he has gotten older, and he has many chronic illnesses, and all he wants to do is stay home and live at home. But our healthcare system isn't oriented around that. We tend to send this gentleman into institutional settings, nursing homes, if you will. So Mr. Jones really doesn't have great access to care. So whenever he needs healthcare, he calls 911. And when he calls 911, he goes to the hospital, and the hospital admits him, and then the admission team decides to send him to a nursing home. And that goes over and over and over again. So the problem we are solving, which is a really big problem, is access to care for people with chronic diseases, chronic illness, and who are older. So at some point in time, you will get to the place that you cannot go sit in a clinic. You can't physically go receive care the way you and I receive care to this day. And that is a huge problem, because it accounts for the top 5% of patients. And in healthcare, we all talk about, as insiders, 5% of patients account for 50% of annual healthcare spending. That is a $414 billion and growing problem. So recently, McKinsey decided that to solve that problem, $265 billion were going to shift care for Medicare and Medicare Advantage patients into the home. So our solution is to do just that. We have defragmented an incredibly complex healthcare system and brought care directly to patients. We also manage problems. Mr. Jones is blind, and so the reason he calls 911 is because he cannot drive himself to a clinic. He needs an ambulance to drive him. So if we bring care to him, we sort of solve that problem, and we help with the social determinants. We offer 2 services: advanced primary care and acute care at home. In enhanced primary care, these are patients with 6 or more chronic illnesses, many medications, well over 20. We see these patients on average 2 to 3 times a month, and they're on service with us for life. But occasionally, one of these patients needs a little more intensive care. So if they have a heart condition, we call it heart failure, you sometimes need a good dose of IV Lasix. We do that in your home. So we spent the pandemic providing hospital-level care to patients in their homes. We kept COVID-19 patients in their homes. We've kept heart failure patients, lung disease patients in their homes to receive their care. Their on average stay with us is about 3 to 5 days, and they have about 2 or more visits a day with us. And we do all of that at a lower cost and higher quality than traditional care. So do we make money? Our revenue model. We partner with risk-bearing entities. Risk-bearing entities, in a health policy nutshell, is a provider group, a health system, or a payer. These folks contract with us, give us money for a fee. We then go take care directly to the patient. We deliver all that care. We generate lots of savings, which then goes back to the risk-bearing entity. So this year, we've made a pretty big move to become our own risk-bearing entity as a provider group. And we did that because our financial savings was really significant. So in the total cost of care for our patient panel, we reduced the cost 33%. And in the last 30 days of life, we reduced that cost 40%. The nurse in me loves this slide the most, so I'm going to take some time on it, but feel free to ask some questions about this later. Our outcomes result in more days at home. So in case you all are not aware, older people love to be home. They do not want to go out anywhere, and they want to sit and watch their shows and be in their home in the comfort of their own environment. And that's really true for me too. I want to receive my care at home. If I'm sick, the last thing I want to do is go to the hospital or a clinic. So we reduced readmissions, which is the largest driver of cost in our healthcare system, 77%. We also reduced nursing home stays 91% over the 2 years of our work. We have incredibly happy patients and caregivers. So 97% of patients love our care and would recommend us to others. 98% family approval. But my most, the statistic here that I would really like to spend some time on, and the thing I'm most proud of, is we have 100% employee retention. So those of you who haven't been listening to the news, we have a nursing shortage problem. So nurses are really, really frustrated with the care that we're delivering and how we're being supported, and we have solved that problem. We not only have 100% employee retention, we have a giant wait list of people wanting to join us. So our revenue forecast, apologies, this is really tiny. So we made over $4 million last year. This year we're making a pretty significant pivot. Thank you. A pretty significant pivot to become our own risk-bearing entity, and that will help us into the future. Oh man, there's my 6 minutes. I thought for sure I was going to do this in no time. We didn't get to introduce our team. Our team is me. I'm Dr. Michelle Schmerge. I have a doctorate in health policy from Yale University. I've been a nurse practitioner for 15 years providing care to older patients, and I have a ton of experience in the home care setting, as does my co-founder, Heather Smith. She's a physical therapist, and she has over 17 years leading alternative care models in the home. We have Bob Seehausen, who is a business development executive for a local health system here based out of Charlotte and Winston-Salem, and he managed a $5.6 billion payer contracts with that system. We also have Doug Young, who's here with me today to help us with technology development. He's a successful, incredibly successful technology entrepreneur who has had 10 successful exits. Our ask, we are offering $2 million of convertible notes with a 20% discount and a 5% coupon. We will use that money for market expansion. We plan to be statewide within the next year. We also need to hire some really great talent, but we're investing in technology. So we are creating cutting-edge technology for logistics, operational efficiency, as well as HR practices. Questions? Apologies for going over.
So Michelle, let me start out by saying great job, and thank you for what you do because so many of these things resonated with me. I have a 92-year-old father-in-law, and he just recently lost his ability to drive, and I can tell you the amount of time that is required to get him back and forth to doctor's appointments is just nothing short of mind-numbing, because when you go to him, pick him up, get him out, get him back in, you're talking like 4 hours, right? So there's a big impact on the folks that are doing that. So thank you for what you're doing. I love the story, right? Making it personal, talking about Mr. Jones, the impact that had that was very, very effective, and you did it in a short enough time, so that was great. I'll reinforce from an investor pitch perspective. The big things that you really needed to focus on were you got an awesome team, right? And the most important thing is you got some awesome revenue, right? And that got buried at the very end of the presentation. So push those up. Push those up, especially if you're in a time compressed setting. I loved. You had a couple of things. I'm going to compliment you. I'm going to criticize one thing. Okay. So that percentage, 5% of patients, right, 50% of the healthcare spend, that's just an incredible number, right? So that really sets you up at a macro level of why are the other risk-bearing entities interested in what we're doing? That's why, right? Because there's a lot of money spent there. And one thing that wasn't clear to me, I'm a reforming economist, was okay, why is it so much cheaper for you to provide the in-care home when you're having to get the health professionals to the home? So that I would, and again, I think it's because their alternative is the most expensive way to deliver healthcare, which is the emergency room. But I would articulate that.
So it's because in bricks and mortar setting, the overhead cost is about 65% that's unnecessary spend in healthcare.
Yeah, so again, you message that a little bit better, and then the one piece that from an investor perspective that raised a little bit of red flag, right? You've driven this $4 million in revenue, and it sounded like that was just in the Charlotte market.
No, it's in Greensboro, actually. I couldn't get anybody to take up my ideas in my hometown.
But it was a single market, right? And then what an investor needs to hear is, okay, if you replicate that in additional markets, is it the same kind of revenue, right? So that would be, hey, we're gonna take this investment and we're gonna get into X number of markets, and then therefore our revenue is gonna be, whatever that is, right? I think that messaging would be critical. But the little red flag was, hey, we've done this and we've been partnering with the risk-bearing entities, and now we want to become a risk-bearing entity. So that sounded like a pivot of some sort, and it made, as a potential investor, that would make me a little bit nervous without further explanation. And again, in the context of limited time, difficult to get all of that in there, but that's the feedback.
Awesome, thank you.
Hi, great job.
Thanks.
In the triangle, of the idea and the market and the timing and the people, like you got to the people last. You hit the idea out of the park.
Yep.
Like Daniel said, just with your guy, I have an 87-year-old mother. The only goal is keep her in her house as long as possible.
Yep.
Like that transcends all goals. And my wife, she has a mother. I mean, we all have it.
Yep.
So it's you don't have to spend. You went into kind of detail with numbers, which were impressive, but unnecessary in the 6 minutes because you get it. I got it. Cool. Like Daniel, I needed a tiny bit more detail about because I literally was picturing you in your Prius with an EKG machine in the back, like, driving out to that guy's house. And I was like, and that sounded expensive and risky, and you got to pay gas, and, so like a little tiny bit more nuts and bolts, just so I could kind of get the picture, because I believed your numbers. I mean, they're pretty amazing. Also, like, it was funny because you were like, sorry, this is so tiny when you were talking about the revenue, but you weren't. You were talking about the slide, and I was like, that's not tiny. I'm like, we're used to seeing like people up there with an idea, and you're just like, we're knocking it out of the park. Again, Greensboro, that was complete reveal to me. You're like a little bit more detail. How you generated $4 million in revenue in Greensboro, like in the last whatever. Like that's really awesome. And saying how you're going to repeat that and how you're going to I key on that. That's really cool. It doesn't matter who your audience is. You're like, that's fascinating. But just a tiny bit more detail about how that happened. The fact that you have a team, because again, my image was like, oh, you're a nurse and like you're out there running around, doing the services or whatever. You just so what's behind you? Just 20 seconds. It will be good.
And I remembered I had one slide I wanted to critique a little bit, and I forgot about it, but it was the one where you had a whole bunch of percentages on there.
Oh, yeah.
And there were too many, right?
Yeah.
People are, it's in behavioral economics, it's, why does McDonald's only offer, small, medium, and large? Because when you do small, medium, and large, 80% of the people are going to pick medium. So that's their highest profit margin item on the menu is the medium drink, okay? Same thing here. Give me like 2 or 3 statistics that I can focus on, because in this one, there was great stuff, but I was trying to write down, and I kind of lost most of the messaging.
Yeah, I would pick the employee retention because I love the.
Oh yeah.
Because I got behind that, like everyone else is having trouble, nurse shortage.
Yeah.
You're like, we got people, those same people are lining up to come work with us because we're doing it right. I would assume that you would have 1,000,000% family approval, and patient satisfaction. It's like I would hammer on that, like that point. That was a really good point.
And I'm kind of curious, Michelle. for those employees, so how many employees do you have to generate the $4 million in revenue?
We had 52 last year. Can I answer some of your questions? May I? My mom? Okay. Do I only have 3 minutes left again? Man, okay. So thank you for your feedback. That was tremendous. And I will see if anyone else has some questions. So the reason that we have this dip is because of kind of the market changing. So we were charging a subscription fee for the patients and having them on service with us for a short period of time. And we realized that the patients did not want us to disengage with them, that they actually needed us through the end of their lives. And so we are now contracted with all the payers, essentially, not just one risk-bearing entity, in order to really de-risk our revenue model in order to have pretty extensive growth in the future. Other question, the clinicians. So we have lots of clinicians who provide care to you. So the premise was really, how do you marry nursing, medical, and physical, which is represented by the physical therapist. Myself, as a nurse practitioner, sort of sit on that fence of medical and nursing. But we have paramedics, we have speech therapy, social work, all the things that you need to deliver care to patients who are chronically ill. And then we can do that all in your home using a model that we've built to figure out who to send, who is best to send for a patient on a given day. And that all comes kind of through a command center. So we go out to see the patient, make sure they have everything that they need. We also offer them access to 24/7 care with a live human. If you've ever been with your 89-year-old family member, they cannot navigate the automated systems. So you need somebody to answer the phone and help them through all that. So part of that is how we were able to generate so much savings. I felt like there was a third question that I didn't answer. Is there anything else we were getting to? Maybe not. Okay. Well, yes.
Markets, right? What markets were you going to go after next?
Yes. So I could only get one risk-bearing entity at the earliest days. I have this crazy idea in 2019, and I want to provide care to people in their homes. And everyone said, that's really crazy. We don't think there's a market for it. They're going to come to our bricks and mortar hospitals with marble floors, and it's going to be amazing. And so I said, I just really think at some point the baby boomer generation is going to say, this is absurd. Like, we should not be receiving care here. We're going to get infections, which, thank heavens a pandemic happens. So this pandemic happens, and we start to provide care to patients in their homes, and we do it better than the hospital. So one of our better statistics, which isn't very popular publicly, is that we have delivered this care better than every floor of the hospital that was helping us. And we had a 0% mortality rate for our almost 1,000 COVID patients we cared for in their homes. And I asked for the dying patients. So when you start to ration care as a medical professional, you decide who is going to receive care. And so I said, give me all your patients who are not going to receive care from you all, and I will care for them and give them an ethical death in their home with their family members, and I'll treat everybody who gets infected, and then they all survived. So we started with just indigent patients, and then we started getting the physicians sending us patients, and so it was a really beautiful, beautiful time. But so we were only providing care in Greensboro. We now, as of last month, have been in 8 counties. We have a goal to get to all 100 counties by the end of this coming year. And we're really opening. I live here in Charlotte, so I have a clinic up in Denver now as well. Is it okay? Keep going. Anybody else have any questions? I could be up here all day talking about it. Yes. Okay. I'm sorry? Yes. Great question, which has been a really funny learning for me. So I don't view anyone as a competitor in life. I think we all should be working together. There are so many patients that need care. It's not funny. So I really did not see this. And so all of us who are doing care in this space have really been helping each other, troubleshooting during the pandemic. I write a protocol that is pretty good in the early days of the pandemic, so we're all sort of sharing all this information. But so there's lots of different entities. We have Medically Home, who's offering the technology for home-based care, for hospital-level care, but they don't offer clinicians. So you have to train up your hospital staff. And one of my biggest learnings really early in my career was that you cannot take a clinician out of the hospital and put them into a home. If you're used to the marble floors and the white coat, you are not going to be happy when you see what's in that home. So it's a really different model of care. And so in my experience, we've all been sort of helping each other and along the way. There's so few of us doing this type of work in the home, and so many patients to serve that there's not a whole lot. There's also Dispatch Health, amazing company, wonderful founders as well. They offer mobile urgent care. They're trying to get more into models like ours. We've all tackled the problem from a different angle. So Medically Home only partners with hospitals. Dispatch Health partners direct to consumer through an online platform. And so we've been able to get our patients in a little bit of a different way in partnering with post-acute entities, so home health agencies, skilled nursing facilities, and hospices.
You guys consider education care for children with intellectual disabilities like autism spectrum disorder?
Yes. I get that question almost daily, actually. Yes. Do we consider providing care to children, people with intellectual and developmental disabilities? In the healthcare space, that's called the IDD population of patients. So I am an adult nurse practitioner. I am only legally allowed to treat patients 13 and up. What happens when you treat patients 13 and up is that you end up just caring for people at the end of life. Because people 13 and up really don't need a heck of a lot of health care until you get to about 60. Then you need a lot. So we have not done that. Now, I started this company because of my grandmother. So the reality is, what these two gentlemen just said, is that their wives or a loved one that is female is dealing with the problem. My grandmother, when I was a kid, my parents were very young when they had me. Thank you for making that mistake. And are very young still to this day, and they're wonderful grandparents to my children, but also just turned 60. So they are, they had to work, right? So my grandmother's my caregiver as a kid, which is what happens when your parents are young. And she was caring for her disabled child and her mother. So she's caring for 3 people, and she couldn't get any of us health care or anything that we needed. And so she told me when I started doing really well academically, solve this problem for me one day, Michelle. You're supposed to help women like me. And the biggest bucket of women, other than the ones caring for an aging parent, is the ones caring for sick kids. And so we have just taken the step to hire our first 2 FNPs, so family, and we are, and I just had a call with the head of Medicaid last week to see if we can get into this space.
My wife does that actually.
Oh, wonderful. Please connect with me after. I love to get us all together. There's a heck of a lot of us out here doing amazing things. I think I'm at time, but happy to answer any questions. I'll be here.
Yeah, I think we're right
Okay,
on time.
thank you.
Thank you.